Welcome everyone to this edition of Sweet Life Talks. Thank you so much for being here. Thank you to Vuyisile Nkalane, who is the podiatrist joining us today to answer all your questions about diabetes and feet. There are a lot of questions about diabetes and feet. Thank you to everyone for joining us today. And thank you to Avid Diabetes Care for sponsoring this series of Sweet Life Talks. So Vuyisile, I'm going to hand over to you for a minute and let you introduce yourself and tell us how you came to become a podiatrist and why you are interested in diabetes.
Okay. So my name is Vuyisile Nkalane, and I'm a podiatrist. I'm based in Durban. So basically, at a young age, I always liked working with my mom's feet, and so I always wanted to work with feet. And I was thinking, okay, then I have to quite research about feet and everything. And I came across podiatry, and I went to Joburg, University of Johannesburg, studied podiatry, and I used to come to Durban just for practicals over the holidays, and I was at Annette Thompson and Associates, and I really enjoyed it. And yeah, I'm here now.
Great. Thank you so much for answering. So we ask these questions on our Facebook page on Diabetic South Africans every month when we do a Sweet Life Talk. And I could not believe how many questions there were about diabetes and feet. And I think it's one of the things that so many people struggle with, and we just don't know where to turn. So let's dive right in. And if anyone here has any questions, you can write them in the comments and I'll ask Vuyisile at the end. So our first question was from Debbie, and she said, what can you do if you have diabetic neuropathy? Is it possible to heal it, and how can you treat it?
Okay. I always advise patients that you actually consult, because it actually presents in different ways and you have to treat it accordingly. So for example, if it actually affects your muscles, the structure of your foot is actually going to change, and then we're just going to have to sort of assess and see what's going to be helpful for you. If you have to change shoes, if you have to go for surgeries or anything like that, if you have to put insoles in your shoes, so that we try and offload areas of high pressures. So if you consult, at least we know what's wrong and we just treat it accordingly. Other patients present with things like severe pain, pins and needles and all those things, and we just have to take each patient differently. And the next question was, can you heal it?
Yes.
So with diabetes, nerves do repair, but they take quite a long time. So patients really have to be patient about that. If you control your sugar and exercise, you can improve the sensation in your feet, but sometimes you can't really cure it completely. You can simply just improve the status of your feet and also prevent it from getting worse.
Okay, so that's so interesting, because to me, I thought, here's what I understand about diabetic neuropathy. It's the nerves in your feet.
Yes.
I think it starts in your feet because the blood flow to your feet is, maybe it's the furthest it has to go. So the nerves in your feet are damaged, but you're saying it presents differently for every patient. That's fascinating. I would have thought that was just a common thing.
Yes, you see, with diabetes, it does affect your nerves, but nerves actually sort of innervates a lot of things. So it actually innervates your muscles as well, your blood circulation and all of those things. So if your nerves are affected there, you're definitely going to affect your blood circulation and also your muscles as well. That's why we have to sort of assess as to which nerves have been affected, and what signs and symptoms you're actually presenting with, and then we just take it from there, because you can't just generalize and say, okay.
Okay, because everyone is different. Why is it that neuropathy, specifically in the feet, is often one of the first symptoms? Do you know? It's one of the first complications that come up often.
You see, nerves are really, really tiny. So if your sugar is really not well controlled, sugar tends to sort of affect the nerves, the nerve endings, because they're like really tiny, and that's how you end up having neuropathy. And
yes, that makes sense. Okay, so then Florence wanted to know, she said, my feet always have this pins and needles pain and they become dry. What could it be? I'm guessing you're going to say it's neuropathy.
Yes, because that's just one of the signs that presents when your nerves are starting to be damaged. So you're going to have that pins and needles, burning sensation, and tingling in your feet as well. And they also become dry as well if like your autonomic nervous system is also affected as well. So your feet will just sort of become dry as well.
And what can people do for that? We get questions about dry feet a lot. Yeah. Do you have any recommendations?
So dry feet, you can use emollients. So any heel balm that has got 25% urea.
Okay.
Anything less than that doesn't usually help. And when you have dry feet as well, we also have to rule out fungal infections, because you can also have dry feet as a result of fungal infection, of which the treatment plan will be totally different from there.
Okay.
So
how would you know the difference, or should you just ask a podiatrist?
Usually the fungal infections goes with itchiness and red patches on the feet as well. Where else if it's just dry skin, it will just basically be dry, no itching, no redness or maceration in between the toes and all of that.
And that would get better. I suppose that's the other way to know, is if it gets better when you put cream with urea on it, then it's just dry skin. Okay.
Yes.
This is one that I don't, so there were a bunch of different questions. I put them all together. So Sandra wanted to know, my feet from late afternoon are very hot and painful. If they get really bad, I soak them in ice water. I hope I'm doing the right thing. And then Aya Majawa wanted to know, it hurts as if I'm walking in hot coal, it's burning and it's painful. So those hot, painful, and particularly in the afternoon, what's that about?
Okay. So they also didn't explain that in the afternoon at that time what exactly they're doing, because so for example, let's say you had a long day at work, you've been walking and doing all sort of things, then you just, when you come home, you just sort of rest or you lie down or something like that, and then your feet are burning and all of that. We usually associate that with blood circulation, because when you're standing and walking and doing all sort of things, gravity also helps with the blood circulation. So the moment you sit down, gravity is really not helping with the circulation, and then that's when you start getting all these problems. Or if the structure of your foot has changed and you're now putting a lot of pressure in certain areas, the moment you sit down, that's when you actually feel pain as well. So we just have to assess the patient and see if the problem is coming from just the fact that they have neuropathy. Is there a problem with the foot structure itself? We also use Doppler as well to check circulation, if the patient still has got enough circulation, because circulation can do that as well. And if it is a problem with circulation, I wouldn't advise a patient to use ice water, because that can just make the problem worse.
So what should they do? If it's circulation?
If it's circulation, I will advise on moving your feet like up and down. So if you, or maybe you can just on your tiptoes down, that can help just to sort of increase the blood flow in the area. Or you just sort of move your feet, that can help as well.
And
but exercise is the most important thing if you really want to improve the blood circulation. So walking.
And what kind of exercise? Walking, okay, because you don't want to do anything too intense, hey, so you've got to pain.
No.
And you said it can change, the structure of your foot can be changed. How does that happen? How and why would that happen?
Okay.
You mean like
so
it says
basically,
I have no idea. I was going to suggest something, and then I was like, I have no idea. Why
okay.
am I suggesting?
Okay. So as I've said earlier, that neuropathy can affect your nerves differently. So let's say your muscles are now affected. So that means joint movement in your feet is also going to be compromised. So now you're going to start putting pressure in certain areas of your foot. That's why we say the structure of your foot actually changes, because the joints in your feet now don't function normally because of the problems with your muscles, of which we have to sort of check as well. Sorry.
Oh, wait. I've lost you're on mute. Hold on. There you go. So you were saying?
Yes.
The muscles
Yes,
in your foot can also change.
Yes, if the muscles are affected, it will limit the ranges of motion in your feet, and then that's how you start putting a lot of pressure in certain areas. Then there we have to advise you on footwear.
Okay.
And if there is really nothing that can be done, that's when we start putting insoles in your shoes to try and offload certain areas, so that when you're walking, you're not really traumatizing those areas as well.
I had no idea there were so many things that could go wrong with feet. Fascinating. Yeah. I can see why you got into it. Wow. Sure.
Yeah.
Okay. So there were also a lot of questions about extreme temperatures of feet. So a bunch of people said they were burning hot. Their feet were always burning hot, which you've spoken to a bit here. And then a bunch of people said their feet were constantly cold. So I think you're going to say that the answer to that is that both times it's the beginning of neuropathy. Could we give some practical tips for what to do? So first of all, what to do if your feet are hot? Like you come home, your feet are burning hot. What do? You come home, your feet are constantly cold. What do you do?
Okay, so if your feet, so let me start with the cold. So if you feel like your feet are actually cold, I always advise patients that at least you would rather put on socks. Even if you double up the socks, that's fine. Okay. Because patients tend to now use warm water or put their feet next to the heater and hot water bottle, of which we really don't advise on that, because you can easily burn your feet in that sense. Or we also advise on certain creams that you can just sort of apply in your feet that can help with the circulation, rather than using heaters or hot water bottles in your feet. If you don't have the creams, rather just put double socks or a sheet in your feet. But we don't really advise on the other things.
Heaters or hot water. And what kind of creams? Can you give some examples? Are there specific ones?
We usually advise on thrombophob gel.
Okay.
Then you can just apply that. That will actually help with the circulation in your feet.
Okay. And then burning hot, is that a similar, is it also from, are they both from the same thing? Can you tell?
Burning, in most cases it is from neuropathy. So we always, because we can't really prescribe medication for the burning feet, we always refer patients to their doctors that can actually prescribe medication for that kind of pain, and it actually helps. But I also always say that for that medication, it's not like it actually reverse the damage in your nerves. It basically just help with the pain. So you still need to control your sugar and exercise so that your nerves can actually repair. But yeah, the medication basically helps with the pain only, but they mustn't now not control their sugar and say, oh, okay, the pain went away, now I'm fine. Where else the damage is just going to continue.
So the most important thing is to have balanced blood sugar and exercise. I feel like this is advice we give a lot. We're always being told the same thing. Okay, then there was a lot of people who were asking about numbness. So Lorraine said, I have very sore feet. The cushions are also sore, and sometimes I get this numb feeling in my big toes. The numbness is also in my left leg above my ankle. That was Lorraine. And Komafive said, why do I sometimes not feel my toes? That's scary.
That's neuropathy as well, when you don't have sensation in your feet, and that's where you have to be really careful with your feet. So we always advise patients, if you now at that stage where you can't really feel your toes, and always wear shoes. If you're in the house, always, so basically you're at a stage where you definitely need to protect your feet, because that's just peripheral neuropathy there.
Okay. And the trouble if you don't, I remember that when I went to a podiatrist right in the beginning, they said always wear shoes. And I said, I thought you were supposed to run around barefoot. We were all taught that when we grew up, so that your feet would become hard. I don't know if we were all taught that, but I was taught that. So your feet become hard and then they don't get damaged. And she said, no,
Yeah.
that was true in like when we were all living in the wild, but that's not true now. And as a diabetic, you must wear shoes at home, inside, outside, at the beach, everywhere you go.
So you actually protect your feet. Otherwise, you can easily injure your foot without even noticing. So imagine you were walking at the beach and it's like really hot, because you can't really feel anything. You can just walk, and by the time you get home, you can see, oh my God, I just bent my feet. Or you can just walk on a pin or something like that. So it's really dangerous. You have to protect your feet at all times.
And the risk of that, I'm just making sure I have the story right. So the risk of that is if you're already not feeling things in your toes or in your feet, that means that you have then definitely peripheral neuropathy. And so if you stand on a pin or a piece of glass or your feet get burnt, that could turn into a sore or an injury. And then if that doesn't, because there's less blood flow to the area because of the neuropathy, then that might not heal properly. And a wound that doesn't heal could eventually lead to amputation. Is that the whole
amputations? Yeah.
Oof. Okay. That's hectic. Okay. Lebo said, my feet are itching in the evenings. Why and what can I do?
Okay. So if your feet are itching in the evenings, we also have to rule out fungal infection.
Okay.
And so if it is a fungal infection, we will prescribe topical antifungals. We will also advise patients to wash their shoes as well, because if you just treat a fungal infection on your feet and you go back and wear the same shoes, you can always reinfect yourself as well. So we advise on that as well. Or if it is neuropathy, because neuropathy can present like that as well. So we just have to sort of assess and see if it's really neuropathy or a fungal infection. And the way you can see if it's actually just neuropathy, you will actually have itchy feet, but when you really look at the skin, you can't see anything. So you don't have any cracks, you don't have any, your skin is just basically clear, but you can actually feel that your feet are actually itching. Then you know it's neuropathy. But if it's actually a fungal infection, your skin is going to be peeling, you're going to have red patches, you're going to have maceration in between the toes, then you know you have a fungal infection. Then you just treat it accordingly as well. Just
what does maceration mean? You said maceration
so
between the toes?
Yes, it's like white in between the toes.
Oh, and like peeling?
Yes.
Yeah, okay, I've seen it. So let's just run through all the symptoms of neuropathy when they relate to the feet, so that people know. So far, what have I got? I've got pins and needles.
Yes.
Dry could also be a fungal infection. Hot and painful. Like walking on hot coals, so that's burning and painful. Constantly cold. Numb feeling. Itching, but itching could also be fungal infection. Is there anything else? That's a lot already.
Tingling sensation as well.
Okay.
Yes.
And so the best treatment for that, you should see a podiatrist so they can confirm that it is peripheral neuropathy, and then keep your blood sugar as balanced as possible. Do some mild exercise like walking.
Exercises as well. Yes.
And then if the pain is very bad, you can ask your doctor for some pain relief medication. So that's Lyrica. Someone mentioned.
Yes,
Lyrica.
That's Lyrica. That's Lyrica. Okay. Yes.
But that won't cure it. It will just help with the pain.
It will just help with the pain. It doesn't really cure the neuropathy itself. So you still have to exercise and control your sugar just to make sure that you don't damage your nerves any further.
Okay. Sharon wants to know what causes cracked heels.
Okay, so with cracked heels, we have to assess the structure of your foot. So if you are putting a lot of pressure in a certain area, you can actually end up having cracks in that area. Or other patients wear like open shoes and they don't even moisturize their feet. That can also cause cracked heels as well. But we basically, if you come and see us, we can just remove the cracked the cracked heels, like the hard skin around it, and we just sort of remove those, and then we advise you on the creams that you can actually use that can help.
Okay. And you said earlier that a cream with urea in it is good. What is that? Is that just one of the ingredients?
Yes,
it's 25% urea.
25% urea, and you can get them from Clicks or Dischem.
Okay, great. And then could you just run us through some general foot care tips for diabetics? So if you have diabetes, what should you be doing for your feet? What shouldn't you be doing for your feet? We already know no bare feet.
Okay, so the most important thing, you always have to control your sugar. So I always advise you check your sugar each and every day. I mean, before you even go to the doctor, you should know how's your sugar like before breakfast, how's your sugar in lunch, how's your sugar after supper, so that at least you also help the doctor as well, so that they have to see how's your sugar like before they even prescribe medication for you. So that's the most important thing. You have to control your sugar. Secondly, you have to actually check your feet every day. If you can't really see underneath your feet, get a mirror, or you get someone else to actually help you. So you're checking for things like cuts under your feet, any sores, any blisters, or anything like that. And if you see anything that's alarming, always consult. I know some patients say, okay, I will see how it's going to look like next week, or how it's going to look like after 2 days or whatever. But it's always a good idea to just consult immediately. And rather the doctor say to you, no, it's fine, it's going to be fine, relax, or going to the doctor and then they tell you, if only you were here 2 days ago, we were going to be able to save your foot. So it's always better to check your feet every day. And if you see anything, just consult. Maybe you can take a picture, send it to your doctor or whatever, but just get the opinion from the doctor.
And will a normal doctor know that? A normal doctor will know if you should be worried or not. You don't have to, or do you go to a podiatrist?
You can go to the podiatrist. Yeah, you can go to the podiatrist. But if you can't really get a podiatrist, you can just even go to a doctor. But you have to see a medical profession.
Yeah. Okay.
And when you, we also spoke about shoes as well. But before you even wear your shoes, always put your hand inside just to make sure that there's actually nothing in there. Because if you have neuropathy and maybe there's like a pin or something inside the shoe, and you're just gonna wear the shoe and then you're just gonna walk on that, and you can just damage your feet. And if you don't have enough circulation, then it's another story. Then we're gonna have a non-healing wound, and then it gets to those gangrene. And also you must wear socks as well. So you can't just for example, if you're wearing like leather shoes, you just wear shoes like that, you don't put any socks. So you always have to wear socks just to protect your feet, and also just to make sure that your feet don't sweat a lot. So if you have like powder and stuff, just put powder and then wear socks. So you can't just wear shoes like that without shoes. And you also have to wash your feet every day with water and soap. And visit a podiatrist at least once a year. Because if you come to us, what we do is we check if you don't have any infections in your skin, in your nails, that can actually predispose you to wounds and all those things. Then we advise you accordingly at an early stage. We also check, as I've said, that neuropathy also affects your muscles and joints. We also check if your muscles are still functioning properly. and if your joints as well are still functioning properly, if you don't have any areas of high pressure, we also assess that as well. If we see that you have any problem, we also advise you at an earlier stage so that you prevent wounds and all the other problems that can come with that. We also check blood circulation as well. So that
which is kind of impossible to check at home on your own, isn't it?
Yeah. We have a Doppler, and we can just sort of check the circulation for you, and then
is a Doppler
we can
the
just
machine
tell. Yes.
That goes on your feet. Okay.
And then
so it can read your heart rate in your feet.
Yes, we just check the pulses in your feet, and then we can just tell you if your circulation is fine. Okay, your circulation is fine, but you still have to go home and exercise and control your sugar. If it's not okay, then we have to tell you what you need to do, and sometimes we just refer you to vascular surgeons if it's like really bad. But if it's not, we just ask you to exercise, and you come back after like 2 months or so, and then we just sort of monitor like that. And if it doesn't get better, that's when we just sort of refer you as well. So it's just basically you just have to visit a podiatrist at least once a year, so that we just check all those things, and then we just see how's your status, and then we just rate you as well if you're like a low risk or a high risk patient, and then you can at least know what to do.
One more question that I didn't understand from earlier. I didn't realize how little I knew about feet. You said earlier that it is important to always wear socks because you don't want your feet to sweat too much. Why don't you want your feet to sweat too much?
Okay, so if you sweat too much, that's just a lovely environment for bacteria and fungal fungus. Okay. So that's how you end up. If your feet are like really sweaty, then the fungus is just gonna be happy to be there.
And what's wrong with the fungus? You end up. I mean, it sounds gross, but why is it bad to have fungus?
The fungal infections, your skin usually starts peeling off, and the patients will start scratching, and then that's how you end up having wounds and stuff. And if your circulation is not good, then that's when you start having non-healing wounds. So fungal infections are really not good for diabetic patients.
Okay. Wow, I have learned so much for you, Vuyisile. So here's what I'm gonna recap what I've learned. We wanna first of all, we want to keep our blood sugar as stable as possible, and we want to exercise as often as possible, not in an intense way, but in a consistent, stable way. Always wear shoes, always wear socks, check your feet every day, wash your feet every day, dry between your toes. And if ever there's something that happens to your feet that looks like it's maybe something to worry about, then ask a medical professional straight away, because once neuropathy has begun, it can quickly make things a lot worse because you have less blood flow.
Yes.
Okay. Look how much you managed to cram into half an hour. Thank you so much. This was so interesting. If anyone has any questions, now is your moment to ask on chat, but I can't believe you answered all those questions that I had for you. I thought we had too many to get through. And I want to thank everyone for coming here today, and thank you, Vuyisile, for your time. And thanks to Abbott's Diabetes Care for sponsoring the series. And sure, I'm so impressed with how much you managed to tell us in such a short time. Thank you very much.
Okay, no problem.
Enjoy the rest of your day, everyone. Bye.
Thanks, you too. Bye.
Bye.